is Christina Landwehr. I'm the National Coordinator for Project Breathe. I'm also based out of the Chicago office for Invisible Fence Brand. And then we have Dr. Contreras out here, who is with the Carroll Stream Animal Hospital. So we're kind of going to go over the program, and then Doctor's going to take over and give you guys some additional pet saving tips, which is always great because really the purpose of this program is that we understand that you guys have been improving when coming into contact with animals in an emergency situation, and these are tools that are just going to make your jobs a little bit easier. So Project Breathe came together in about 2010. And kind of the idea behind it is that if you know Invisible Fence Brand, we keep dogs and cats safe in their yards on a daily basis. We do pet containment, and so this was a natural extension for us, and the fact that we're able to provide you guys tips and tricks and tools to be able to keep pets safe during an emergency situation as well. So we know that it is not a kept up statistic with the U.S. Fire Administration as to how many pets succumb to smoke inhalation yearly in house fires, but we were hearing anything from like 40,000 to 150,000. I mean, regardless, a really high number, and we wanted to be able to help you guys out with that. Part of the thing too is that we understand that in some situations you guys have cats go and hide, they're under the beds. It can get stressful. Dogs tend to follow their owners out. We had an instance one time where we were doing a donation at a Denver fire department, and the chief over there was letting me know that they had recently had a house fire. They were kind of trying to get everybody out. He found a mass on the floor, pulling what he thought to be a body out, felt about 200 pounds. When he got outside and away from all the smoke and everything, it ended up being a 200-pound Great Dane. And so it's much to his surprise, he's like, I don't know what to do with this thing. So these masks here are they're versatile, and like I said, just made to make your jobs a little bit easier. So I'm gonna grab Benny really quick here and kind of show you guys what you get in the kits. Here, Benny. This is Benny. He is a 2-year-old Welsh Terrier. He's my little demo dog that comes with, and he's got the snout for the masks. Yeah, right? No, perfect. Part of the thing with masks is that, like I said, they're versatile. So if you're coming into contact with a pet that maybe isn't completely down and out, you can take off this rubber part, especially for like a bully breed, like a bulldog or something like that, be able to put that there. Because as you know, the human oxygen masks, they don't provide a nice airtight seal over the dog's snout. Therefore, a lot of oxygen is getting wasted and it's not really doing much for you. So this provides a nice concentrated flow of oxygen to the dog or cat. We've seen animals that have been completely down and out and not looking great back on their feet within 15 minutes after using these masks, which is really nice. So it just kind of, obviously Benny would be laying on the floor not doing so great if he was in an emergency situation. You can see over here that this large size is going to be your best friend. This is pretty much going to be your go-to, but we've got a medium and a small here too, so if you come into contact with a gerbil, we had a fire department out in Seattle that rescued a gerbil with one of our masks, a bird, a cat, a snake, whatever you guys so please, these are going to be able to help you out. When hooking up to the oxygen tanks, we have proper tubing that will go with it. The level of oxygen is 1 to 3 for the small, 3 to 5 for the medium, 5 to 7 for the large. You guys do get an info sheet that kind of walks you through everything too. It's laminated, so it's good if you guys are out there in the field. The valves on the side obviously allow, if the tank is running heavy, to allow oxygen out or bring oxygen in. But additionally, you can pop off this top red part here too and use it with a BVM and kind of just as you please. So again, just really different ways to be able to make it easier. Additionally, in the kit, you also have a slip lead, which is really nice. Reason why we added this is because you guys are doing a great job. You save the animal and then all of a sudden they take off and go running down the street, and we don't want that either. So there's a couple different ways to use this, but we're donating 6 of these kits to you guys today, and we're definitely appreciative to have the opportunity to do that. If you guys know any other fire personnel in other departments and they do not have these kits, we do donate these at free of cost to any fire department that's in need of them all over the United States. So, and with that, I'm going to hand it over to you.
Appreciate it.
Of
Okay.
course.
So we will. I'll
Flip.
Yep. And so I just want to commend you guys. I appreciate you guys having interest in showing because again, a lot of these are obviously our humans. Again, humans come first, but our pets are like our family. Okay, and if any of you guys have pets, you know how close. And again, so I really commend you guys for coming out and just listening to this, and hopefully that we can do some good. So the first thing that we do is that, again, the first thing you always want to do in a pet that is unconscious, you want to see if they are breathing first, okay? And so the things that you can do is that you can put your hand first on their chest, evaluate them. Again, if you don't feel them breathing, the next thing that you can do is kind of, as you're feeling them to see if they're breathing, you can reach on the side here. So, all right, so our buddy here has a little, they call it femoral pulse, okay? So when we're laying on our side, okay, you can kind of feel right here, okay, underneath the big femoral artery right there, and you can kind of feel that, see if that's pumping. So then you can know, again, if their heart is still beating or not, okay? And then you can see if they're breathing or not, okay? Again, at that time, again, hopefully, again, you guys are a team, so you guys will have multiple people with you. Next, if you know the patient is unconscious, okay, the next thing you want to see if there's any kind of obstruction in their airway, okay? So the next thing you want to do is you want to open up their mouth, okay? Again, pull out their tongue, okay? Again, we won't have to do it for them because we're awake, but you just want to see if any of the airway is obstructed or not, okay? And then again, if there is nothing there, at that point in time, a lot of times, again, this will be different if we have this, but if we don't have something like this, one of the things that we want to do is that we want to cup their mouth like this, because we don't do mouth to mouth with dogs, we do mouth to snout, okay? And so what we would do is that we would place this over, our hand over their mouth, okay, to make like a seal. And then you would breathe into their nose, okay? So you cup their hand, breathe over their nose, and then what you want to see is when you give them breath, you want to see if their chest, again, expands or not, okay? Because then you'll know that they're able to get, obviously, oxygen, okay? And so then, again, you can absolutely, this is going to be the best thing here, okay, to put this on their face, because then you're able to give them 100% oxygen, okay, right away. And then after that, again, if they are still unconscious, not breathing, the next thing we want to do, all right, is to start, again, to do chest compressions, okay? The way we want to do chest compressions in our animals is, again, we want to have them on the right side, okay? Oh, you guys getting a call? Oh, okay. You want to put them on the right side, okay? This has to do with their anatomy, okay? And so then the next thing what you want to do is you want to basically put your hand, okay? Put their arm back here, and that's going to place their arm here, okay? You place their arm, and you place it right back here, all right? This lets you know they're right over their heart. You're going to be able to place your hands right over their heart, okay? And so you just put their elbow back like that, and then you just cup your hands like this, okay? And then then the way you want to do chest compressions is you want to basically do about 30%, 30 to 50% of their chest compression, okay? That's how much you want to compress their chest. And again, that's what that's doing is providing circulation to the rest of their body, okay? Getting it basically, you're basically being the heart at that point in time, okay?
They have to be on the right side?
They don't have to be, but that's definitely the best side for them to be on, okay? And that has to just do with the anatomy, the way the heart is structured, and then you're going to be able to basically pump everything most efficiently, okay? On that side, it's a great question, okay?
And the elbow back, that's pretty typical is for you to find your landmark.
Universal for our cats and our dogs, absolutely, good deal. Yeah, and again, it just kind of places it right over where you want to place your hand, okay? And that's going to be the most effective way to place your hands and to provide chest compressions, okay? And then again, you want to do about 30, all right? 30 chest compressions per every time you give them a breath. Again, if you have this option, this is going to be the best thing. Okay. Unfortunately, when I talk with owners, right, they don't have this. Okay, so they have to breathe into their nose. So they'll do 2 breaths for every 30 chest compressions. All right, but this is providing them oxygen. And again, we want to make sure that we're completely every time we pump. And again, the way we want to do it is, do you guys do the same thing? I think in humans, staying alive.
All your protocols exactly the same.
Good deal. All right. So it's like staying alive. Staying alive. That's the way we want to do it. We want to make sure we recoil every time, okay? And so then after that, again, we want to make sure we're reassessing the patient, and we want to try to get them again to a vet hospital, obviously as soon as you can. Again, if you have 2 people, the other person in between the chest compressions can actually push, okay? So as you recoil, you can push on their abdomen, push on the pet's abdomen. That will also help to increase circulation as well, okay? Provide getting blood up to the heart as well, okay? And you want to do, does that make sense as far as when you recoil, the other person would push down on the abdomen, okay? And so it's another thing that can help, again, increase circulation again to your heart and to your brain and everything like that, okay?
Dogs have a carotid in the neck.
Yes, they do. Yes, they do. And that is a place absolutely you can feel. It's just the easiest place. Oh my goodness, yeah. Absolutely. And again, if you guys can, if you have a pet at home, go ahead and try to feel. To me, the femoral is the easiest one. You can also feel the pedal one on their foot, okay? But again, by far, the femoral one is the easiest one by far to feel, okay? They're going to be on their side as well too. So that's the way, again, you can also feel the chest, feel the femoral pulse, and see again if they are breathing or not. No, again, so now, not all dogs are going to be this size, right? So again, with our really huge dogs, all right, again, the 200-pound dog probably that we buy, you probably want to go actually a little bit lower down the chest, only because it's going to be a lot harder. Now, some of you guys, I think it's going to be fine, because some of you guys are pretty big guys, okay? But again, if some of these dogs are going to really hurt, so it's going to be hard to kind of really compress their chest. So actually, you can actually use the top of their chest to kind of push and help kind of get things going, okay? Get things, circulation going, all right? Again, with our smaller, even with our, if we have a cat, you can actually literally have their hands on their chest like this and just give them chest compressions just like this, okay? In some instances, again, with some of our pets, again, even with some of our brachycephalics or smush-faced dogs, okay? Actually, they have this barrel chest, okay? And if they're really small dogs as well, you can actually pick them up and do this, okay? And provide chest. So again, this is probably definitely the most effective way, all right, to do it, all right? But again, sometimes, again, like you guys know, you have to kind of do things as you go, okay? And so, any other questions about anything, guys?
Do the numbers change up at all with the size of the animal?
Nope, the numbers didn't change up at all. Again, technically, I guess with like a cat, you maybe want to go a little bit faster with your heartbeat, okay? Again, with our huge Great Dane, again, you can probably go a little bit slower. Again, in an emergency situation, again, just remember that song. That's pretty universal, okay?
Are they, so most cats are at about 100 beats per minute?
Yep, absolutely. So our cats are probably around, again, they can get to 180 to 200, yep, okay. But
Cats
yeah.
are either skittish anyway.
Oh yeah, absolutely. So, yeah.
How long do we do CPR before we consider stopping?
It's usually, again, there's no set time, okay? But honestly, again, in the hospital, I know we reassess every 15 to 20 minutes. And again, a lot of times it's pretty unlikely after that time that we're going to be able to get them back. Okay? All right, good question. And again, we want to try to do these things as fast as we can in an emergency situation, but we do want to try to get them to a vet hospital as fast as we can. Again, you guys aren't going to have, I'm sure not going to have atropine, epinephrine, and all those medications that we can try to quickly give. But if we can start these things many times, okay, and a lot of times you guys can't get the heart going. You guys can't get the heart back, and then we can rush them to the hospital, okay? Definitely can save life. All right, any other questions? Those are great. Any other questions?
Yeah, I got actually two.
Yeah.
Sometimes you get air in the stomach with humans. Is that something that's going to happen with?
Yep. They can absolutely. You can get a little. They can get a little air. No, not a huge problem with them. Okay.
And is there a way to tell, like, if we're being productive in humans, if they're blue, we're obviously doing something wrong?
Absolutely. Good deal. Absolutely. You can absolutely assess. Okay. Look at their gums. The only problem is with a lot of our dogs. All right. Their gums are really pigmented, okay, and that's normal, okay, but you can look at their tongue, you can look at their gums, and you can definitely see if you guys are eating, and they will pinken up, absolutely, okay. You can also feel, hopefully, again, look at your own dogs, if you can, get a little portion where it might be pink, press on their gums, see how quickly it goes from white to pink, okay. Looking at capillary refill times, absolutely, so that was great, absolutely.
So tongues are a good indicator of...
Tongues can be a very good indicator many times. Now, if we have a chow, right, right, that's not going to be a good indicator, right? They got that purple tongue, okay? But they're fine, okay? So, right, we have the different breeds.
Does that change? Does that purple tongue change?
No, it does not. No, it does not. You cannot tell in that breed. I'm sorry, okay? Those dogs are really hard to reassess. But in most cats, dogs, again, they're going to be pink, okay? But yes, there we have some breeds that they are the way they are. Okay, so good question. Anything else?
Follow up with,
Yeah.
I mean, you're obviously great for that after this,
Mhm.
let it run around, that's why you give us some heat.
Yeah.
Right, they should go for.
Oh, they should, absolutely, okay? Because again, if there was something else going on too with the pet, again, they just have to make sure they're reevaluated. You have to make sure again too, because sometimes, again, even when we're doing chest compressions, again, if we accidentally crack a rib or something like that, sometimes they can get a pneumothorax, okay, as well. And again, we get them back, that's great. Now we have to sometimes we have to suck out the air inside their chest, okay? So again, those are certain situations that come up, but again, and those are our reasons why we want to get them to the vet when we can to make sure we evaluate some of those other things. Good deal. Yeah. Guys, I really appreciate it. I really appreciate you guys, again, taking the time and wanting to learn this stuff. And again, any questions, you guys can always give me a call, again, at my hospital or anything like that. And so, but we really appreciate it.